He said, Mike, I've got some not real good news for you. He says, you do have prostate cancer. I set up an appointment with Dr. Simpson, and Connie went with me. And when we left, we looked at one another in the car, looked at one another and said, this is it. This is what we're going to do. We're going to have Dr. Simpson help us. Dr. Simpson is an absolute professional. He's the definition of professional. And he exudes incredible knowledge.
Mr. Hobbs and I talked about the treatment options. He decided he wanted to have the 5 treatment regimen. So we had his urologist place markers in his prostate. And then about a week later, we did a CT and an MRI for treatment planning. And then a physicist and I generated a computer plan. And that took a few days. And then we did the treatment.
So we went in on Thursday and Friday. And Thursday freaked me out because of the roll. It was freaky, but it was cool. Because I just laid on the table and tried to stay still and listen to my music.
So we take an x-ray, we see where the markers are. It's a kind of a hybrid system between the therapist and the robot itself, in the sense that the therapist can see where what the robot has recognized as the markers and can say to proceed with treatment, and so we keep treating. And then basically we treat over about 30 minutes. We're imaging the prostate usually every minute. If it makes a slight change, we can readjust where we're treating so as to minimize any dose to normal tissues.
Thursday worked out great, Friday worked out great. I started to come down with some side effects. On Monday we talked about it. They said, well, let's make some adjustments in the medication. And so we did, and then on Wednesday we did the 4th treatment. And then on Friday we did the 5th treatment, and we're done. I think it's a combination of the confidence I have in my doctors, the technology with Cyberknife and the treatment. Yes, I had some side effects. They're not fun, but the side effects are way secondary because I've lost weight because of the diagnosis.
Usually most of the side effects have resolved by week 3, or starting to resolve by week 3. Usually by the time I see them week 4, they're saying things got better last week.
I have much, much more energy. I worked 52 hours last week at 70 years old and had fun. Watched softball games on Saturday. We don't miss many games. We've got chairs that have seen hundreds of games. We've traveled around the country for baseball and now softball, to our grandson's college in Nebraska to watch him play baseball. Finding out the biopsy, no fun. Getting the markers placed on the prostate for the treatment, no fun. Getting the hormone injection shot in your belly, not a lot of fun. But the actual, the CT scan, the MRI, the Cyberknife treatment is a piece of cake. If the side effects are all that you have, and some guys will probably have a little more so than others, and some guys won't have much. But if I'm getting rid of the cancer, that's a very small price to pay.